Correct. All right. Thank you very much, sir. We look forward to talking to you in just a few minutes as well as we move forward. So real quickly, who is AMBA? We have partnered with TPEA to make sure that you have the best in-class supplemental benefits, discounts, access to all kinds of fun stuff as well that makes the value of your TPEA membership that much more. And so our biggest goal, though, is to make sure that membership continues to increase with TPEA. For a state employee, if you're not a member, it's only $7.50 a month for active employees, $2.50 a month for retirees, as well as those associate members, a spouse or something like that who may not be state employees or retirees. So we want to continue to grow TPEA so that when Ann and Ray go to the Capitol and say we've got 30, 40, 50,000 state employees and retirees behind a certain bill, it really turns heads. So that's our number one goal. As Ray mentioned, ERS goes through every year and they look for new benefits. They look how to define their benefits. They talked about the insulin. They've made some minor tweaks to the premiums in the vision plan. What TPEA does is they look at those benefits that the state provides and comes to us and says, hey, where are the gaps? And so we can help provide those, fill those gaps that aren't covered. They're portable benefits. When you leave the state, you're not able to take most of your benefits with you. The good news about the TPEA benefits, you can take them with you. You can extend those benefits. If you've got a child that ages out of your dental plan because they reach age 26, you've got the ability to get dental insurance through TPEA and provide coverage for them. Also, the biggest thing that most of our active employees say is with the right type of benefits on their parents or their grandparents, it prevented them from having to take days off or exhaust all of their PTO as they go forward. But today we're going to talk about cancer, heart, and stroke insurance because it's a gap the state does not even provide coverage for beyond just your basic level of coverage. So we're going to hit into a bunch of different things. Feel free to grab a pen and paper, take some notes if you want to. Just the sad fact, unfortunately, 1 in 2 men and 1 in 3 women are going to contract or be diagnosed with cancer sometime in their lifetime. You see the issues over there. Prostate and breast are the top 2 for males and females last year. American Cancer Society says that the good news is we're able to diagnose it earlier. The bad news is more people know that they have it. So there's some good and bad in regards to that. But so cancer is out there. It's pretty prevalent. So roughly about 41% of the American population at some point in their life will be diagnosed with cancer. And I'm sure everyone on this call knows of someone who has or has themselves. And when you look at the ERS website, and I will tell you, I've spent a lot of time on the ERS website. It's a great website to understand your benefits, both active employee benefits, retiree benefits, your pension system, how all that stuff works, those type of things. If you look at these optional add-on benefits, you'll notice there is nowhere do they offer any type of cancer, heart attack, or stroke type coverage in addition to the type of coverage that you have already. So that's why the TPA has stepped up and says, we need to provide something for our members because so many of the costs aren't covered. And I want to share with you what those costs can be. And then I want Ray to kind of share his testimony as well. So you have very good medical care through the state plan if you're an active employee or if you're a retiree. And most folks labor under the misunderstanding that their health insurance will cover everything if they get a cancer diagnosis. The good news is there are low copays for your doctor visits. There are a wide variety of covered treatment plans that are out there. The networks are pretty broad, especially if you live in a major metropolitan area. And because diagnosis and treatment come so much earlier, survival rates are increasing. That's the good news. The challenge comes in is that some of these co-insurance clauses start to get very costly for hospital stays. Sometimes the treatments that the doctor recommend are not covered out there, or the specialist may be out of network, or you get a treatment late in the year, calendar year, and you start a new calendar year next year and have to go over with all your new co-insurance again, your co-pays, things like that. Then depending upon where you live, you have transportation costs if you have a cancer diagnosis. I live a little north of Houston. For the past 30 years, I've flown in and out of Houston all the time. I meet people who are flying from all over the country to get their cancer treatments done in the medical center in Houston. It's a phenomenal center, but that airplane costs, the hotel costs, all those things for themselves, for a family member or a loved one to come with them, those are not covered as part of your insurance plan. And then, as Ray will talk about, you start to lose your income because you run out of PTO, because you've exhausted all your days as part of your recovery. And then little things that you think should be covered, like anti-nausea medication, wigs, prosthesis, things like that, you'll find that those comfort care items are not covered as part of most medical plans. And then any type of care, if you've got to take care of a child while you're having treatment done, those things are not covered. Or if you have to take care of a parent, you're responsible for a parent, if those things are not covered, you've got that in there. So again, then the recovery afterwards, your at-home recovery or long-term care recovery is usually not covered depending upon how long it takes. If you're a retiree, depending on what Medicare does and how they say that your treatment was done and your initial service was performed, some of those things cannot be covered. So that's really what we want to talk about. We've got a mix of people on this call today. We've got several active employees with the state. We also have several retirees. So some of these things may apply to you now. Some may apply to you later in the future. So when we talk about certain things like Medicare, we're going to talk a little bit about, for those who are already retired over 65, the biggest thing I want you to take a look at, Medicare has a very good brochure called Medicare Coverage of Cancer Treatment Services. It's only about 11 pages. It'll put you to sleep, but it's very specific. And what I like to tell people is watch for the qualifying language in their cancer coverages. Part A, when it talks about inpatient stays versus observation status. Many people don't understand that you could spend 3 nights in a hospital after a cancer surgery, but you may not be admitted as an inpatient person and you're just there in observation status. That totally changes what could happen to your Medicare coverage down the line. Certain implants, if it's done in an inpatient setting, cannot be covered for Medicare recovery. Many drugs, some oral chemotherapy treatments. Again, Medicare is real good about couching the language of what they cover with qualifying language. May, some, many. Big concern there. Then you see down here, I pulled this directly out of this brochure. Medicare does not cover any of those recovery type services related to activities of daily living that don't require skilled care, adult daycare, those things that you do after you recover. Here's something else that I pulled out of there. This is really what scared me the most when I looked at the Medicare brochure. I want to read this verbatim. Medicare may have a maximum payment amount for certain types of services and may not pay coverage for some services. Your doctor or your healthcare provider may recommend you get services that Medicare more often than Medicare covers, or they may recommend services that Medicare doesn't cover. If this happens, you have to pay for all or some of the cost. Again, that's Medicare directly telling you, if your doctor goes outside of a plan of treatment and recommends something that's a little bit more aggressive or something that's not just typical standard care, you may have to pay some of those costs. And it's too late once you've got a diagnosis and you're already shocked to the system that way to have a significant income hit as well, because you weren't prepared for what the diagnosis of cancer and the treatment following after that could be. So really what it boils down to is you see all these things around this couple here, the child care, the transportation, the special food, loss of wages because of loss of hours of work. It boils down to about 60% of the cancer related costs are not healthcare related expenses. And if they're not healthcare related expenses, they're not covered by our medical plans at the state. And so that's the reason why the TPEA has stepped up to partner with AMBA to provide some options for you as well. But before we talk about that, Ray, kind of tell us in your own words, we're glad you're here. Glad that you went through this and survived this, but tell me a little bit about what happened and how cancer impacted you and what you found out.
Thank you, John. I mean, it goes without saying cancer is not a walk in the park, but I did have a solid health plan, but I found out some things about it going along as I went along, and this was something that wasn't anything any normal person would pay attention to, and that is that while there is a cap, a maximum out-of-pocket cap or a stop-loss cap on the insurance plan in terms of your out-of-pocket costs, the copays, and there are copayments for every single scan that you might imagine, and every single prescription that might, even the chemo, for example, all of those copayments, they are not subject to that same maximum out-of-pocket limit. There is a federal limit now around $9,000. But that was not something in my budget at the time, and that was a real surprise. Additionally, there, of course, John mentioned this, there are transportation costs. I had to be at some point taken off. I wasn't allowed to drive. And so I had to find people to drive me to all my various tests and procedures, et cetera. And in my case, I didn't go to Houston. A lot of people end up going to MD Anderson from all over the state. But even if you're not doing that, you still have far-flung sites to go for tests and procedures. And John mentioned this, when you get home from the hospital, you don't necessarily have coverage for just the basics of providing for instance, for changing your bandages, for if you've had surgery, for preparing your food, for helping with the bath, and those kinds of things. And those are, if you have to pay somebody to help you with that. And in my case, I had some friends that were very helpful. But anyway, it's just there's a lot of costs that you don't put into your budget necessarily. Additionally, I lost income because I was at that point already a consultant, and I was a pre-Medicare retiree, by the way. And I had to basically curtail some contracts, and other contracts were cut down, and because I just couldn't deliver the service that was needed of me in my consulting contracts. So I do recommend anyone that has a history of cancer in your family to consider a cancer insurance policy. It is just it's necessary, and it will give you a lot of peace of mind for your budget, et cetera. So, and this is yet another reason I want to say for joining TPEA, because TPEA is not only looking out for you with the legislature, but TPEA is providing you these very, very targeted benefits that aren't quite covered. They're not completely covered by your state insurance plan. So I just thank you, John, for an opportunity to share with folks how, yes, it's a stressful experience, but added to that stress is just the sheer monetary drain that you have when you're going through it.
Exactly.
So I think there were a couple of questions, but I don't remember. I haven't seen them yet.
Okay. Well, thank you, Ray. I appreciate you sharing with us. Again, we want you to hear straight from someone who's experienced that, who's one of your fellow state employees and retirees, how the impact of that is. If you look at the number of people who have financial challenges after a health issue, it's astronomical. And the TPA wants to avoid that. You've worked all your life hard to provide for yourself and your family. To have some type of diagnosis hurt you. And so that's why you do have options as a state employee and as a TPA member. We have partnered with TPEA to provide you a lump sum cancer policy that can give you cash to use any way that you want, anywhere from $5,000 to $75,000. We see people use it to cover just their normal bills. They cover their out-of-pocket expenses in terms of transportation, hotels, things like that. They will use it maybe to have one of their family members take off work and pay for their living expenses as well. It covers heart attacks and strokes as well. You can use it for, we've even seen people that use it for a bucket list trip. Their cancer is advanced to a stage where it's not treatable, and they can use this money to provide a bucket list or provide life insurance after they've passed away, because they may not be eligible for life insurance. One of the biggest questions that we have is, does this impact my other insurance? There is no coordination of benefits. You don't have to worry about this. It is all separate. It has no impact on your state benefits or your spouse's state benefits. You can cover this for yourself, for your spouse, for your family, depending upon their ages in there. If you've had cancer in the past, depending upon the type of cancer and the length of time you've had cancer, you can receive benefits as well. Everyone's situation is so different. But the biggest thing that we like to tell people is not that you want to get cancer, but that when you do, you don't have to worry about the financial side of the house. You can concentrate on getting better and not having to worry about the money drain on the other side of the house for you. You can customize your plan, start out very low, cup of coffee a week kind of cost, something like that. You can add specific benefit riders on there that increase every year, or add additional radiation and chemotherapy, specified diseases beyond cancer, stroke, and heart attack. You can put accident coverage on there as well. The one that I really like is the cancer reoccurrence benefit rider. Depending upon the type of cancer that you have, you can have anywhere from a 5 to 100% chance of recurrence. My wife's cousin had breast cancer 13 years ago. Last year in a normal mammogram, they found it again 13 years later. With the recurrence rider benefit on here, depending upon how long it's been, you can get up to 100% coverage restored back again. So again, peace of mind, you don't have to worry about those things. I'll take a pause here. If you've got any questions, feel free to put them in chat or Q&A. Everyone's situation is different. If you're a retiree and you're receiving your pension checks, and those are providing your standard of living, and you think, well, I don't need as much because I just need it for a specific instance or to cover travel costs, something like that, you may want to talk about a lower number. If you've got a young family, you may want to consider something that's a little bit higher in value than the dollar amount to give you more coverage out there. We can talk about who qualifies. If you are on your cell phone, or if you have access to your cell phone, open up your camera, hover over that QR code, scan that, and it will come to me, and we'll get you in contact with someone who can walk you through the process. Jeff asked about the price range for insurance like this. Jeff, a lot of it is age-based and dollar amount based, but we're talking, depending upon if you're an active employee, you're probably looking at $15 to $30, $45 a month, depending upon the level of coverage, the riders and things like that. The older you get, of course, it costs a little bit more, but most of our members find that it is extremely inexpensive, and it's very well fits into the budget. So feel free to hit that QR code up if you want to talk about that. That's a good question. We can answer those questions specifically for you, go through a proposal, talk about what's best for you and your family. I'll have that QR code up. I'll have my email up here in a moment. Just a quick reminder, we continue the summer education series all throughout the rest of the summer. Check your emails for registration invitations. Please, when you register, make sure that you use your personal email address. What we're finding is that many people will use their state email address if they're active employees, and it filters out in the spam filter your personalized link to come back to the webinar whenever it's time for that. So please use your personal email address when you register there. Check your spam filters. You can go also out to tpea.org to register. We've got our most fun one coming up here in a couple of weeks. It's the perks of membership. We're talking about all the fun stuff that comes with membership. Then we've just spent some time with Ann Bishop just this past week working on a pre-retirement seminar. Now, this is not your Ready, Set, Retire seminar that you have with ERS, which is phenomenal. You need to participate in that. We've taken kind of the tips and the backroom talk, all the little things that you need to know, that you need to prepare for 10 years into your career, 5 years before you're ready to retire. And we're going over all those things. So it's going to be kind of a behind the scenes look. And you want to kind of fill in what we're looking at doing?
Sure. There's a lot of things that change once a state employee retires, including, of course, what kind of insurance you can take with you. You certainly can take your life insurance with you, but some of the other, as well as some of the other insurance, your dental and your vision insurance. However, you cannot take your life insurance. You have two options on life insurance, and that is $10,000 or 2 times your annual salary. But the premium goes up significantly every 5 years when you take your life insurance with you. So if you think that you need life insurance for a spouse or for a dependent in the future, that's something to consider. Also, something to consider is inflation, because the current ERS groups, which are groups 1, 2, and 3, do not have any COLA or inflation protection. How do you prepare for 20 or 25 years into retirement without a cost of living increase? So we'll be talking about some of those items.
And to add one thing on that, your life insurance, you may have the type of term life with the state now that's 4 times your annual salary. What Ann's talking about is that gets limited to twice your annual salary. So you you can only carry half of your term life amount with you when you leave and retire.
Exactly. So take advantage of this opportunity that those who've gone on before you are going to share their tips and tricks. And we're excited about being able to offer this. We're also going to be bringing back 2 of our most popular conversations about the emergency transportation challenge in Texas. We're going to be bringing back long-term care. We're going to divide it into 2 different conversations. Long-term care 101 is the basics of long-term care, why the state no longer offers it. And then because long-term care is beyond just going to a nursing home, we're going to introduce long-term care 201. What happens if I have to have a knee replacement surgery and only going to be laid up for 3 months? What happens there? Those little things like that. So we're going to show you lots of different options, lots of different things that are going to take place out there. Make sure to check your emails out there. Hannah sends out great emails reminding you to register for all of those things. So please, 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 the best way we can grow the TPEA is to let your coworkers know or your fellow retirees know about these webinar series. Have them join us, invite them to join us, let them know what the TPEA is doing on their behalf, and get involved in these Lunch and Learn series. So we're going to wrap this up. Everyone have a great Independence Day.
John, I
Yes,
think
sir.
there was one question, Bo, you had sent out a question, I think, on the chat.
Yeah, thank you. We did have one question just going back to the pension. Mark had asked a question that said, since current employees that are eligible to retire would not have a foreseeable retirement pay increase for 4 to 5 years, is it possible to offset the current monthly 9% contributions to make up for the shortfall for eligible to retire employees?
And you want?
There's a lot packed in that question there. It sounds
Yeah,
like
there is.
Yeah, I was trying to break it down. See any retirement, right? There's not an offset to the 9% contribution per se, but what we would do is try to make contributions to your Texas Saver plan. And there are various rules for Texas Saver in terms of 401k versus 457. You can contribute a maximum amount of $19,500 per year per plan to help bridge any kind of gap with a COLA or inflation protection. Also, if you are over 50 years of age and you're planning ahead, then there is an over 50 catch-up provision as well that allows you to contribute another $6,500 to your plan. So there are a variety of ways to put away other pre-tax money, but it wouldn't offset your 9%, or it wouldn't remove the 9% contribution.
right. Okay, thank you very much. Thank you all for attending today. Have a great Independence Day celebration. If you have questions, my email address is on there. It's jon.green, like the color, at anba.info. You can email me just your name and phone number. We'll get somebody that can contact with you. And then you can also use this QR code on your phone, hover over with your camera feature, use that, jump in on that, just select review my benefits, and we will have someone get in contact with you, cover what benefits you've got as a state employee or retiree, and then show you some of those gap fillers that can possibly take care of you in the future. So, Ray.
And I just have one housekeeping thing. Did somebody answer Jeff's question?
That was.
We do have another question. Is the price range for this
Yes,
insurance?
we did answer Jeff's question.
Okay, all right. Thank you.
Thank you very much. Y'all have a great weekend. And again, I'll leave this up. If you have any questions, feel free to email me or use that QR code. Thank you very much and have a great weekend.